Hi, everyone. My name is Shari Eberts, and I'm a hearing health advocate and the founder of livingwithhearingloss.com, which is an online community for people living with hearing loss and tinnitus. I'm an executive producer of We Hear You, a documentary about the lived hearing loss experience, and the co-author with Gail Hannon of Here and Beyond, Live Skillfully with Hearing Loss. I have an adult onset bilateral genetic hearing loss and have worn hearing aids for almost 30 years. I'm excited to talk to you today about the patient perspective on person-centered care and audiology. And I give this talk a lot to audiences of audiologists so I can share the consumer perspective with them. But today we're going to talk about what we as people with hearing loss need to know about person-centered care. So why should we care about person-centered care? It sounds like something technical, maybe that's something that hearing care providers should worry about. So why is it important for us, the people with hearing loss, to understand what it is and how to look for it? And it's important because understanding person-centered care helps us be an educated consumer. It sets our expectations high, which is where they should be, that we're going to get quality care. It teaches us what to look for in an audiologist and puts us in charge of our own care, and it increases the chances that we're going to receive the best advice. So what is person-centered care? Person-centered care is about focusing care on the individual. It ensures that people's preferences and values guide clinical decisions and that prescribed care is respectful and responsive to each person's needs. And now this approach applies to all types of medical care in a wide variety of settings. But for audiology, I've identified four main parts. The first is partners with you. And this means taking the time to understand each person's specific hearing needs. Each of our journeys is unique, so a one-size-fits-all approach is not going to work. Second is makes the office hearing loss friendly. Audiologists must remember that people are there because they cannot hear well, and they must set up their office with this in mind. The third piece is embraces creativity. Audiologists can get trapped sometimes in a hearing aid only approach, but more than that is usually needed. Linking aids or cochlear implants to other assistive listening devices gives people with hearing loss greater access in a wider variety of situations. And last is to think beyond the technology. Now, devices are a critical part of success with hearing loss, but as Gail Hannon and I describe in our book, Here and Beyond, there's a softer side as well. And audiologists could be helping us with that too. So let's talk about how you can identify if a provider is practicing each piece of it. So partners with you, what should you look for? Does your provider ask for your input? The best ones will have you prepare for your appointment by filling out a questionnaire to identify your most challenging communication problems and the top 3 situations where you desire improvement. If they don't ask you, how are they going to know where you require help? Second is, do they listen to your priorities in addition to the test results? Audiograms and other tests obviously are critical to understand absolute hearing thresholds, but they don't reveal outside factors like your work environment or what coping strategies you already use. Make sure they focus on your individual needs, not what worked for others with similar test results. Do they empathize with your journey? Respect and compassion are important parts of developing trust and rapport. Make sure your audiologist is taking the time to get to know you and what communication situations are most important to you. And do they include the family? Family engagement is critical. They are our most important support network, and they need to be informed about our hearing issues so they know how they can help. Sometimes family can be skeptical, thinking that we're ignoring them or not trying hard enough to hear. But learning about our difficulties from an expert like an audiologist can nip some of those feelings in the bud. Plus, your provider will learn a lot from them about where you're struggling the most. Second is makes the office hearing loss friendly. So what should you look for here? It really starts with making the appointment. Obviously, using the phone is challenging for many people with hearing loss. The receptionist must speak slowly and clearly, especially on the phone, and even if better if they allow patients to make or confirm appointments via email. Second is they create a quiet and well-lit office. Background noise makes it harder to hear. So when the decor includes carpet or other sound-absorbing materials to minimize sound, we see that they understand. And then a well-lit office is also better for lip reading. The third thing to look for is, do they share relevant literature in the waiting room? Do they have information and brochures from local hearing loss support groups, or subscribe to relevant magazines like Hearing Life, which is published by Hearing Loss Association of America? Materials like these show us that we're not alone. They should use hearing-friendly office procedures. So does your audiologist alert you personally when it's time to come in? Even in a small office, it can be hard to hear when our name is called. And just a little tap on the arm is all that's needed. In today's COVID world, this could mean something different, like making sure the captions are turned on for telehealth appointments, or that clear masks are used for in-person visits when they're needed. And lastly, is they supply information in writing. Sometimes we miss important details about our care, but maybe we're too tired or embarrassed to ask for a repeat. And the best providers will give us a summary of our test results, what they mean, and a list of recommended action items in writing at each appointment. This way we can easily share the information with our family or refer back to it if we have questions later. And of course, all financial information should always be in writing. Third is embraces creativity. So what should you look for here? Do they embrace assistive listening technology? Hearing aids and cochlear implants are great, but we all know that in many situations, they're not enough. The best audiologists will suggest a variety of technologies depending on the situation. So some, like Roger Pens, will be made by traditional hearing aid companies or CI manufacturers, but others might be direct-to-consumer devices or even apps. Do they share their favorite apps and innovations? Maybe they use a corner of the waiting room to highlight T-coil technology or TV connectivity tools and the latest apps or gadgets that make living with hearing loss easier. And do they encourage us to use external accommodations? The first time I learned about CART or even Hearing Loop was at an HLAA convention well into my hearing loss journey. And this should not be the case. Providers should educate us about all the ways we can hear better when we're out and about. And are they willing to teach? The best audiologists are not only experts in audiograms and hearing aids, they're also counselors and teachers. And as technology changes, they need to stay up to date, so we can too. The last part is thinks beyond the technology. So what should you look for here? Your audiologist shares best practice communication tips. You can share these with your communication partners so they know how they can help. And ideally, your provider will provide a written list so it's easier to share with others. And we all know that small changes in behavior can make a huge difference in effective communication. They teach you to be a better listener. Communication is a two-way street, and while our communication partners must make most of the accommodations, there are also things that we can do. Examples include staying up to date on the news and other happenings so you recognize new names more easily, or to schedule important conversations for the morning when you're rested. They will help you manage hearing loss exhaustion. I wish my provider had warned me about this, but only by comparing notes with other people with hearing loss did I realize this was normal and that I needed to pace myself to maintain energy. They promote self-advocacy skills. We must learn to ask for the assistance we need, but this can be tricky, and audiologists can help empower us by teaching us ways to ask for the help we need, including the power of self-identifying as a person with hearing loss. And last but not least, to recommend hearing loss support groups. Meeting other people with hearing loss helped me build confidence and overcome my feelings of stigma. I learned many tips and tricks from my hearing loss friends that I use today to live my best life despite hearing loss. and I only wish I had learned about the joys of hearing loss peers sooner. So thank you so much for having me talk with you today. And here are my contact details. Please reach out. I would love to hear from you. Thank you.